Well, good afternoon. Lee Harris on behalf of Shelby County government. Pleased to be here for the Joint Task Force briefing. Let me begin by saying the message last week was at once simple and profound. If you're vaccinated, you're safe. No masks, no social distancing. That was the announcement a few days ago from the CDC and President Biden. Our federal partners have advised that we can eliminate masking in most circumstances for vaccinated individuals. This represents a real milestone for Shelby County and for the nation. As a result, our local health directive was updated to reflect the new CDC guidelines. Thus, Shelby County has lifted the masking requirement for fully vaccinated individuals. It aligns with the CDC guidelines and aligns with what's happening in virtually every community across the country. This is really good news, and this is the best sign yet that we are on the path to normalcy. So I, for one, am excited to see smiling faces again. The CDC changes also represent a new incentive for everyone to consider vaccination. Of course, first and foremost, please consider vaccination because it's the way you keep yourself and your loved ones and your community safe. But in addition, the new CDC guidelines have produced an additional benefit of vaccination. Once you get vaccinated, you have the option to do most of the things you did before the pandemic and to do them without a mask. This shift in policy will require all of us to adjust in a year when we have made many, many adjustments. So even though you have been vaccinated and have protection, it may take time for everyone, everywhere, to warm up to the idea of not wearing a mask, and that is okay. During this time of transition, I would ask everyone to be respectful of one another, our neighbors, and our loved ones, as we continue to move through this phase of the pandemic together. Even with the new changes here and around the country, one thing is clear, and it's this: Shelby County and the Joint Task Force will continue to push vaccination for the next several months. Just a few days ago, I was with several volunteers knocking on doors in parts of South Memphis to help spread the word about vaccination. Our focus was communities with a relatively low vaccination uptake rate. It was hard work knocking on doors and canvassing the neighborhood. We ended up knocking on more than 1,000 doors, but this is what's necessary at this time in our fight against COVID-19. Thus, I would encourage you all to please get involved, and we can even put up the slide. So you can see the slide right now. You can sign up at shelby.community to keep informed of similar volunteer efforts. You can also start your own effort because throughout the pandemic, we have learned a lot about public health, but let me conclude by saying more importantly, we've all learned over the last 14 months that life is too short and that things can change in a moment. Make sure you get the vaccine. Make sure you talk to your friends and your loved ones about the importance of getting this vaccine. At this time, I bring to the podium David Sweat. Thanks.
Thank you, Mayor. Welcome to everyone. I'm David Sweat, Deputy Director, Shelby County Health Department. So for an update on where we are with the numbers, we have reported so far 97,675 individuals infected with COVID during the epidemic. That's an increase of 62 new cases yesterday. We've also had 1,646 people who have unfortunately died from the pandemic, but no new deaths in the last 24 hours. The surrounding counties were at 7,403 cases in Tipton County. In Fayette County, we've had 5,126 cases reported. In Crittenden County, Arkansas, 5,710 cases reported, and 21,906 cases reported out of DeSoto County, Mississippi. In terms of the vaccine campaign, which Mayor was just discussing, we're at 340,391 individuals documented in TINIS, the Tennessee Immunization Information System, as receiving at least one dose. That includes 81,575 people who are partway through a two-dose series and 258,816 people who are fully vaccinated with 2 doses of either Moderna or Pfizer vaccine or 1 dose of Johnson & Johnson, and it reflected in TINIS. We know that this is an undercount, meaning there are more people than this vaccinated, because data entry takes a little bit of time to catch up to the reality on the ground. We also know, for instance, that the Veterans Administration has vaccinated thousands of individuals, many of whom may be Shelby County residents, and yet those records would not be in tennis. To every person who has been vaccinated, we just want to simply say thank you, because the people who are vaccinated brings us to 48.6% of our vaccine campaign target goal at this point, and means that 36% of people in Shelby County have been vaccinated with at least one dose. And we have had some questions, several questions have been posed. I know that there's a lot of discussion nationally about the concept of herd immunity and how close or how far away from it are we. And to answer that, I would just say this. Herd immunity is a concept, but what we're really asking when we ask that question is how much longer before the pandemic ends? We will get to the end of the pandemic when the virus doesn't have anywhere else to go, where the chain of transmission can't be sustained and the chain of transmission collapses. That's when herd immunity, effective herd immunity, will be reached, and that's when the pandemic will end. That's not a single point in time, and it's not a single place. For different age groups, we are approaching herd immunity. If you're over 65 years of age in Shelby County, the likelihood is that most of the people that are your peers are fully vaccinated at this point, and herd immunity has probably been achieved for those who are over 65. But if you're in your 20s or your 30s, we're nowhere close to it. In our youngest age group, only about 25% of the people who are eligible for vaccination have been vaccinated. So it's going to be a long time before we get to herd immunity for that demographic. On the eastern side of the county, more people are vaccinated than on the western side of the county. So on the eastern side of the county, we're closer to herd immunity. On the western side, we're further away from it. So there's no one single moment in time when we will reach herd immunity. But what we can say is that if you want to get there faster and you haven't been vaccinated yet, please come out and get vaccinated, because that will get us all closer to that day and that goal. And for more information about the progress on the vaccine campaign, I invite Gina Sweat to join us.
All right, thank you, David. Thank you, Mayor Harris. I'm going to sound like a broken record here. Please go get vaccinated. We are still maintaining our public vaccine sites across the city. I just want to remind everyone that minimum age to receive the COVID vaccine is now 12 and up. And that means that anyone over the age of 12 can come to any of our public vaccination sites and get vaccinated. To date, since the 12 to 15-year-old age bracket came online, we've vaccinated approximately 1,800 of those individuals. So I just wanted to, just like the other two have said, if you want to get us closer to herd immunity where we can get back to normal, we are also encouraging you to come out and get vaccinated. To just let you know, some scheduling changes this week in our vaccination sites. Wednesday, the 19th, will be the last day for our FEMA and Department of Defense partners at the Pipkin site. They will be leaving the site, but the site will remain open at the Pipkin building. The new hours will start on Thursday. This week at the Pipkin site will be 9 to 6, Monday through Saturday. That's 9 to 6, Monday through Saturday. At our Pipkin location, we will still be open, and we have plenty of capacity to handle vaccinations. There's no appointment necessary, so just come on out. Also, this Friday, May 21st, will be the last day of vaccinations will be at the First Baptist site in Bartlett. So Friday, May 21st will be the last day at the First Baptist site in Bartlett. So if you're in that area and you've been waiting to get vaccinated at that location, you've only got a few more days to get it done there. Also, just to let you know, we are having, we're still having multiple community pods throughout the community. So you can go to the covid19.memphistn.gov site to look and see where those community pods are being held across the city if you have an interest in going to one of the smaller pods. Including this Sunday, May 23rd from 10 to 4, There's a event called Vaccine on the Green at Handy Park down on Beale Street. This is a partnership with Satellite Healthcare in the city of Memphis. Our Memphis Fire Department vaccination unit will be there on site. We call it the vaccine machine. So Memphis Fire Department personnel will be there assisting with this effort. You come out and get vaccinated. My understanding, there's going to be some meal vouchers for a Beale Street restaurant. There'll be live music and also booths set up with educational materials about the vaccine if you have some questions. Also, would like to remind you that getting the shot isn't just your best choice for staying safe and healthy. It also gets you a shot at winning that brand new vehicle. And that could be a Chevy Camaro, Chevy Colorado, Nissan Rogue, Nissan Altima, or a similar vehicle of equal or lesser values up for grabs. And all you got to do is get vaccinated. You got to be over the age of 18 to register. And you can go online to register, again, at the Memphis COVID site, covid19.memphistn.gov. So I know that there's a lot more people that have got vaccinated that haven't registered yet. So go ahead and get registered. You have up until the 31st of May to get registered for that. And can't wait to give that new ride away to one of our Shelby County residents who's out there, who got the vaccine, protecting themselves, protecting their family and loved ones, and helping us protect the community. And with that, I'll turn it over to questions from the media.
Andy Rock, Fox 13. Hey, good afternoon. I am just wanting to know about, so we had our first big event, outdoor event over the weekend, which was Barbecue Fest, and I just wanted to see how that went. I know that people were required to wear masks inside, but it seemed like a lot of people took them off while they were there. So with more outdoor events coming up in the summer, are there going to be masking requirements at those, or just wondering about that?
So thank you for the question. As far as how did Barbecue Fest go, I wasn't there, so I can't speak to that. What I know is that we once again had an event in Shelby County, event here in Memphis, where people could come together and do so safely because it was an outdoor event. And per the CDC guidelines, if you're outdoors, the risk of transmission is extremely low. And if you're fully vaccinated, it's perfectly safe to be around other people without a mask on. So I think that all of us can use the break, right, from the past year of the pandemic. And as we begin to do some of these other events, like going to 901 FC or going to the Redbird games or going to Overton Park to the Shell for Music outside with other people, I think all of us will enjoy that. And we can do that safely under the current CDC guidelines. So at this point, we're optimistic that this is an important turning point for the entire community to begin to enjoy the benefits of 340,000 plus people coming out and getting vaccinated.
Thank you. And my second question is, what are the legal requirements when it comes to employers and vaccines? I'm just wondering if an employer could legally require an employee to get vaccinated.
Well, we have a lawyer in the house, so I'm going to turn that one over to the mayor to answer as best he can.
Yeah, I'll answer it as best I can. I think that an employer could require their employees to get a vaccine. I don't think there's any prohibition against it. However, I don't know that I've heard any news reports of any employers doing that. I think most employers prefer carrots and incentives, and so we see a variety of incentives among employers. And we encourage Mid-South employers to consider what kind of incentives they could offer their employees in order to get the vaccine. We've heard tales of employers that have offered their employees a $100 incentive if they, go get the vaccine, which is a great incentive. But even more than that, we've heard tales of employers just making time off available for employees to go get the vaccine. So any of those options are, we encourage employers to take a look at to get their employees vaccinated. And in Shelby County government, we are trying as best we can to track how many members of our organization are getting the vaccine. And who knows, we may also come up with an incentive program for our employees to get the vaccine as well.
Kelly Roberts, WMC.
Hello, my first question is dealing with those slight changes that were made to the current health directive following the CDC release of its new guidelines. I just want to be clear on something. So it says that if you have been fully vaccinated, you're not required to wear a mask. And then in section 2, it says that you have to wear a mask. Sorry, let me rephrase that. So it sounds like that those who are not required to wear a mask, including those that are fully vaccinated, then do not have to wear them, say, at businesses who still are requiring to wear masks. Is that the case? Because that's what it appears to be written at this point.
So I don't have a copy of it in front of me, but the short of it is business owners can decide for themselves how they're going to administer their property and what rules they'll establish to welcome their guests. So businesses and organizations and other settings can decide, as long as they post proper notice, that guests and visitors are required to wear a mask. That was the pre-pandemic set of rules, and we returning to the pre-pandemic way of looking at things. And that is, again, that private business owners, restaurants, organizations, et cetera, do have the ability to administer their property as they see fit, so long as they post notice about whether or not masking is required. And that kind of notice or that kind of policy, at the discretion of the business owner, would apply whether or not you are fully vaccinated.
Okay, thank you. Second question, when it comes to with the relax of masking, for example, but with some establishments possibly still mandating it, when it comes to code enforcement in the health department, is there a different way you guys are going to go about it? Were there a lot of calls over the weekend? What's the message that code enforcement, or at least those who would go on calls for these kinds of complaints, say not masking, what kind of message they're getting?
So I'll defer to David Sweat or Director Sweat. We have two Sweat actually, if they want to chip in here. But I can tell you on my floor, the calls we have received have been joyous. I think a lot of folks have made various sacrifices over the last 14 months. It kind of matches their intuition that the inoculation does offer protection. And so for them to get word that the CDC and the science match up with their intuition, that the inoculation provides protection, was a joyous and happy moment. And so those are the calls I've received over the last several days as we enter into this new phase, is people that are looking forward to an opportunity, once they're protected, to get out and enjoy the amenities. And so again, I just flag that it's just another opportunity, another incentive for people to get vaccinated, because if you get vaccinated, in most circumstances, you're going to have very, very low risk, be protected, and be able to enjoy all that our community has. Code enforcement.
So thank you for the question. I mean, we are not taking enforcement actions at this point against businesses because it is their choice whether or not to require masking in their premise, right? So if they're requiring it, they've chosen to do that. The health directive says that if they post a sign and ask people to wear a mask in their business, then as a patron, the expectation is you will do so. That's what they said they want you to do, and it's their place of business. But if they say, if there's no post, there's no signage, there's no sign saying it's required, and you don't want to wear a mask or you're fully vaccinated and you walk into that place and they're not requiring it, you're in compliance with their wishes, right? Because they don't have any posted signage. So what do we do if we get a call? We have a conversation and say, all right, so if you feel uncomfortable as a citizen or as an individual because there's a place you want to go to and they're not requiring masks anymore, we remind them that they have the choice also to not go there, right? And but if there's a call against a business, the most we do right now is a technical assistance visit. We go in, assess the situation, have a conversation with the owner, just let them know that some folks called, but review with them what they can do to make the premises as safe as possible. But at this point, it is the business's choice. either to require masks or not. But as citizens and as customers and patrons, if we approach a business and they do have signage up, and the expectation of that business establishment is that they want their customers to wear a mask when they're there, it's just like at a restaurant, you know, that has a sign up says no shirt, no shoes, no service. We respect their wishes, and it's up to us to comply with them in that instance.
Jane Roberts, Daily Memphian.
I wonder if someone can address why the case counts per 100,000 in Shelby County are so much higher than other counties, including other metro counties in Tennessee?
Well, I mean, our case rates per 100,000, I haven't compared them to the other metro counties right now. I've been watching our trends. This morning, our case rates per 100,000 over the last week at 11. We're about at 11, so we actually are coming down. We've been coming down slowly for a few weeks. As far as how we compare to other metros, that one I would have to go look at. Jane, I'm sorry, I have not looked at, I don't know which metro in particular you're interested in, and I can compare those numbers. But as far as the level of transmission in the Mid-South, where are we right now? We are on a slowly declining trajectory. It's been coming down since about Easter, a little bit at a time. Over the last 7 days, we've averaged 118 cases per day. That's down from the previous week. And our case rates have gone from about 16 per 100,000, or a little about right after Easter, to about 11 per 100,000 right now. So it's a slowly declining trend. And all of that suggests that transmission is slowing down. And but as to how we compare to other metros, I'm sorry, I just haven't been looking at that lately.
Thank you.
Laura Testino, Commercial Appeal.
Hi, my first question, I'll have two, is about the FEMA presence. You know, within here, we were able to give 3,000 shots a day at the Pipkin, but rarely got above 1,000. Is there a way that the federal resources could have been better deployed to reach more people? And then in part with that, you know, was the city or county constrained by the federal government as to how to use the additional resources provided by FEMA? And I'll have a follow-up.
Okay, yes, thank you for that question. So the FEMA CVC site, you're correct, was scaled up where we could handle 3,000 shots a day. And I think the closest we came to that was about 2,500 a couple of days. Just the thing is, once they came to town, we started seeing a decline in the vaccination rate at all of our community vaccination sites. So I don't think it was just the Pipkin site on its own. As a matter of fact, it's probably kept a little bit higher rate of vaccinations at that site just because of the capacity, and maybe because we've advertised it a little more in the media, or it seems like it's been brought up in the media a little more. But we, as far as constraints of the FEMA and the DOD folks, that we had to, you know, they had to work at that site, so we couldn't use them across the other sites. But at any time, we had plenty of capacity in our city to handle the vaccinations that were coming. As many as 60,000 a week we could have done, and quite honestly, I'm not sure, other than dragging people down there kicking and screaming, what else we could have done to get people to come down and get vaccinated.
All right. The second question that I had, you know, in late April, when it was announced that that the FEMA site was, you know, planned for April or for May 17th to leave, the city also announced a planned decrease in vaccine supply from the regular 60K, and at that point, it was scheduled for May 22nd. Is that pullback still scheduled? I know that it was mentioned that a couple of sites are coming offline. But is that pullback from 60K still scheduled for to start at the end of this week?
Yes, actually, the FEMA folks will be leaving on the 19th, which is Wednesday, and then we'll also on Friday the 21st, the First Baptist site will be closing for now. But at any time, I will say this, and I'm sure I speak on behalf of the county and the city. At any time, if we get a tremendous increase in uptake of vaccinations, we have the ability to flip the switch and to build that capacity back up. We probably can't bring the FEMA folks right back to town, but we have a lot of capacity left in the system, and I, for one, would be thrilled to see the community come out and try to overtax our resources by getting vaccinated. So I think at any point, we can we can crank up the volume a little bit, and as many people come out, we'll find a way to get them vaccinated. So I encourage the public to challenge me on that and to come out and see if they can overtax our system.
Aaron Wilson, Local 24.
Hi, just, well, maybe two quick questions, but I'm not sure about the second one. The first one is kind of just a follow-up to the first question that was asked about the festival that we just had here. I know that you guys have said that there's obviously a decline in cases, but was there any, I know you may or may not have said this already, but was there any type of increase in cases from that festival, or is it okay to say that that type of event coming up for other events in the summer, like you said, are pretty safe because that one was a success?
Yeah, I'll let David speak to that.
Yeah, well, it's too early for us to know whether there is an increase associated with the Barbecue Fest because that just ended. Today's Wednesday. It would be 7 to 10 days after the event before we would see any signal. I'm not even sure what the attendance was there at the event, but what I can safely say is so far there has not been any indication, any signal of an increased number of cases, but we wouldn't expect one this close to any specific event. And you had another
Okay.
question? You had another question?
No, I don't think I need to ask that one. Thank you.
Okay.
Hannah Grabenstein, MLK 50.
Good afternoon. My question is for the mayor. I was wondering how Thursday and Friday went with the literature drop, and if you have like any type of benchmark or any type of hard number way of saying this was a rousing success, or any way of gauging the success.
Well, it was a rousing success from my perspective. We use a specialized app to execute the door knocking and canvassing campaign. And based on that app, there were about 1,000 doors that were knocked on. In addition to that, it was a beautiful day, and we were in a vibrant community. And so there were scores of people walking and that were outside that we were able to talk to in addition to knocking on the door. So when it's all said and done, I'm confident we reached more than 1,000 households across those couple of days. So I think it was a great success. We've begun the planning for the next set of those. I think it's really important, for example, that we reach out to the Latino community. And so we're looking for volunteers that will support outreach in those Latino communities and really do the kind of, sweat work or the sweat equity, put the sweat equity in it and help us to reach out to our Latino community residents and give them information around the vaccine and how it can reduce risk.
And I guess, do you have any way of determining, will we, we know X number of people have come out for vaccinations as a result of this, or, Y number of people have reached out for more information or anything like that?
That's a good point. Yeah, well, I guess we probably could integrate it into our VaxQ. We haven't gone to the VaxQ in a long time, but there's a lot of information in that system that we started several weeks ago. There may be a way to integrate it. We haven't had those kind of conversations, but I think that's a great idea. Thanks for that.
Are there any closing messages today?
I just thank you all for sticking with this community for 14 months. It has been quite the year, but we've learned a lot about ourselves and about our resilience. I think right now this community is really poised to bounce back. You heard Director Sweat talk about an opportunity to visit Beale Street, which is one of our most important cultural amenities in the city on Sunday. You can visit Beale Street on Sunday and get access to the vaccine. And so if I remember correctly, that was 10 to 4 this Sunday on Beale Street, 10 to 4, this Sunday on Beale Street. If you have been not getting out, it's an opportunity to both get out, see Beale Street, but also get inoculated. So thanks very much to all of you. That's
Thanks,
all.
everyone. We'll be back on Thursday.